Hello, this is Miss Hatfield, and today we're going to talk about communicating in groups. So what's the difference in a group and a team? Well, the main difference is the presence or absence of shared goals. Teams have shared goals. On a healthcare team, the shared goal would be to provide the best possible care to the patient. So what happens within a team or within a group to help to promote communication? Well, there are different roles within the group. There are facilitating roles and inhibiting roles. And these roles do pretty much what they sound like they do. Roles that facilitate communication are those roles that help to clarify and address conflict. And they also seek participation from other group members. So if the role you play in a group is one of being a facilitator, then you're actually promoting the processes of a group. You're promoting communication among group members. Think about your skills lab group. Is there someone who helps to promote other people learning in that environment? That person would be a facilitator, or they would have a facilitating role in that group. What about inhibiting roles? Well, inhibiting roles exist within groups, and these are the roles that are played by people who seek to dominate a group or who have their own goals. These may be people who don't participate well in the group. They may make negative comments about the group. They may do things that actually inhibit the group from growing or changing or resolving conflict. Think about a group that you've been a part of in which everyone acts just like you. Although this might be appealing in a social group, it's probably not the best for a work group. Why isn't it the best for a work group? Because no growth will occur and creativity will be stifled. This type of group is called a homogeneous group, and it's said that groupthink is happening. The problem with groupthink is that there is no problem solving and there is no change that takes place in the group. An example of this might be day shift versus night shift. You might hear a group of day shift workers say that the only shift who does any work around here is the day shift. What can night shift possibly be doing because all their patients are asleep? So as you can see, this doesn't promote patient care or make it better in any way. It just really promotes conflict between those two groups. While some disagreement is good in a group because it prevents groupthink and it promotes problem solving and it helps to demonstrate strengths among group members, remember that too much conflict within a group can actually hurt the group and cause a lack of unity. There can be miscommunications, stress, conflict, which can ultimately affect your job satisfaction. And that is ultimately going to affect your teamwork, which could negatively affect patient care, and it could also, in the long run, affect your health. So it's important to work together and have a strong team, but to be able to express differences in opinion. So this is where I want to introduce you to the idea of team building. Team building happens when we establish a spirit of trust and cooperation among group members. We have to have cooperation among group members in order to have a strong team. In order to have a strong team, we need to be able to manage conflict. Remember, conflict is not always a bad thing. Conflict can cause people to grow and to change for the better. So let's look at some common beliefs about conflict that are not always true. The first one is conflict is a sign of trouble in the group. We're taught from a young age that conflict is a sign of a problem. So it's not always a sign of a problem. It can actually cause people to change their behavior. Another common belief is anger is destructive and negatively affects others. That's not always true. Our behavior and how we respond to our anger can have a negative effect on others, but it's normal for us to experience anger. If left alone, conflict will take care of itself. This is also not true, and conflict tends to get worse if it's left alone and it's not addressed. Conflict within a group must be resolved immediately. This is also not true. We're often not taught how to take care of conflict and how to manage it. However, it doesn't have to be resolved immediately, but it does need to be addressed. There will always be conflict in groups, and in order to facilitate change and growth within a group, we have to learn to manage this conflict. Conflict is inevitable. So how do we manage it? Well, we need to recognize some of the causes of conflict. And one way to do this is to look for people with knowledge that does not match ours. If I know something that you don't know, this can cause conflict between us. Look for people who have skills that are different from ours. This can cause resentment and problems between group members. Think about the difference in what a care partner knows and a care partner's background and what a nurse knows and the nurse's background. Sometimes assumptions are made by one person or the other about the other person, and this can cause conflict. People who are competing for rewards can often face conflict with one another. Unclear expectations of a role. If you're not clear about what your job is or what the expectations of you are, then that can certainly cause conflict for others who feel like they are clear about what the expectations are. Sometimes conflict can be resolved by just clarifying those misconceptions. And then, unfortunately, there are sometimes people who have hidden agendas, people who do not have your best interest at heart. And ultimately, you may not be able to resolve conflict with these people. And in that situation, you would need to identify your chain of command and, of course, involve your manager. So with conflict management, keep in mind that you need to hear all sides of the conflict in order to resolve it. You need to listen to all sides of a conflict in order to resolve it. And also keep in mind that there are certain statements you can use that actually promote resolving conflict. Try to use I statements. I noticed you haven't been on Blackboard to do your homework. I think that's a problem. I think we need to address that problem. This turns the focus onto you and not the other person, which can help prevent them from feeling attacked. So we need to learn how to communicate in a way that is assertive and not aggressive. With assertive communication, we're being direct, honest, and appropriate. We're expressing our needs and expectations in a way that does not infringe upon the rights of other people. We can best start these comments by using I statements or the first person. And then try to make sure that your verbal and your nonverbal message are congruent. If you express an assertive comment with nonverbal messages that are aggressive, then you're not going to convey the message that you intend to convey, and you may actually make the situation worse. So be mindful of your nonverbal behavior and what that conveys about you. With assertiveness, let's look at a continuum of assertive communication. If we place our communication style on a continuum and we say on one end we have a passive style and on the other end we have a very aggressive style, then an assertive style would fall somewhere in the middle. The passive person or the person who uses passive communication does not stand up for themselves, and they often allow their rights to be violated very easily. On the other hand, the aggressive person stands up for themselves. This will result in the rights and the dignity of other people being violated for their own rights. By contrast, the assertive communicator is able to express their thoughts and their feelings and their wants without infringing upon the rights of other people. They actually show respect for other people. Let's talk about the ABCs of assertiveness. The A in the ABCs of assertiveness is going to involve expressing your thoughts. The B is expressing your feelings, and then C, expressing your wants. So if we start our communication by expressing our thoughts, we might say something like, I saw that you were late today. Then express your problem. I get frustrated when we don't start on time. And then express your wants. I want you to be here at 7 o'clock. That's the time that we agreed upon, and I expect you to be ready to start at that time. Expressing yourself in this way makes your needs and your expectations clear to the other person in a way that's not aggressive and doesn't infringe upon the rights of that person. Try to focus on the information and not the other person, and that will prevent them from feeling attacked. When you express your wants, be very specific. I expect you to be here at 7 o'clock is a very specific want. That's a very specific and reasonable request of someone. Think about how you would feel if you were working with another care partner who constantly started their blood sugars late. And let's say each of you had 6 blood sugars to do every shift. So you were constantly waiting for that person to finish with the glucometer so that you could get the glucometer and take care of your own patients. Well, you could run and steal the glucometer before they get started and make them even later, or you could go to that person and talk to them directly and in an assertive manner. You could say something like, I saw that you were late getting your blood sugar started. I think this is a problem because it's very frustrating for me when I can't get my blood sugars done on time. So what I would really like for you to do is try to get your blood glucoses or your blood sugars done by, give them a specific time. That way I can get the glucometer and start mine on time. Most people will respond to assertive communication if you make your needs and your expectations clearly known to that person and you give them very clear ideas about what you expect of them. Some people, however, do not. You may have to deal with people who are actually being aggressive with you, verbally aggressive, or just not responding to your assertive comments. At this point, here are some comments that you can actually use with that person to help diffuse the situation, and then hopefully readdress it when both of you've calmed down. You might try saying, I feel very uncomfortable with your tone of voice right now. If someone yells at you in front of a patient or yells at you in a nurse's station in front of other employees, you need to feel that you can talk to this person and tell them, I would like to discuss this with you in private. That's always an appropriate response. You might also say something like, I will gladly respond to your questions when you speak in a reasonable tone of voice. You might say, I'm feeling very angry right now. I think we both need to take a breather and let's discuss this again later. I think that's a very reasonable expectation, and it can help to prevent a conflict from turning into a full-blown fight in an inappropriate place or time. Let's talk about some different responses to conflict. Everyone responds to conflict differently. Some people run from it, some people welcome it. Here are some common responses to conflict that you do need to be very clear about what the definitions and examples of each one of these responses includes. Avoidance is the first one we're going to talk about. Avoidance is a don't rock the boat kind of style. It's a lose-lose situation because the conflict is usually never addressed. Members try to ignore their differences and they don't address their differences. So the cost of the conflict is higher than the benefit of using this particular style to respond to conflict. By contrast, there's domination. Domination is a response to conflict that is power-oriented. Domination is delivered with force. Domination is a win-lose situation in which the dominator, or the person who's behaving in a dominant way, will do whatever it takes to get their way. This is an effective way to get things done quickly, but used over a long period of time, it can interfere with team spirit. Dominating behaviors might be okay in an emergency situation. Let's say a patient has coded and one person steps in and delivers their message with force, and they say, you initiate the emergency sequence, you start chest compressions, you go get the crash cart. That would be very appropriate in that situation. Collaboration or collaborating types of conflict management. With collaboration, there's an exchange of information that goes on between members. There's a desire to reach a solution and an acceptable solution for all parties involved. Collaboration is usually a win-win situation when everyone will take something away from the situation. It encourages creative thinking and problem solving. The problem with collaboration is it takes a long time. If you've ever sat down with someone for the purpose of making sure that everyone involved got something from the situation, that can take a long time for everyone to agree upon what is taken away from the situation. But it's the reason it's good is that everyone's point of view is taken into consideration. Accommodation. Accommodating is another response to conflict. By accommodating, you give power to other people. If you're an accommodator, you actually are in a lose-win situation. Excuse me. You're cooperative, but not assertive. And in many ways, it's like avoidance. It's very self-sacrificing, and it's often used to simply preserve harmony. So once again, this is not something that is going to promote any kind of growth or change, but it won't address the conflict at all. And then lastly is compromise. With compromise, the team members look for a middle ground in a conflict. Both parties have to give up something to get something, but negotiation and bargaining skills are used in order to come to a solution.